I have to say, you brought this up. It was something I want to hit on, that autonomic nervous system. So overlooked by most people. Most people don't even quite understand what a ANS autonomic. They just hear, oh, it's my nervous system, whatever. It is basically, it runs so much. That fight or flight response will cause inflammation, lower immune, everything. So
Yeah.
we're such big proponents of seeing, are you balanced or not? That is one of our
Good.
main core principles when you come in. And we're looking at heart rate variability, all the other things. And nowadays, like you mentioned, you have access to these HRVs and an Oura Ring or other, apps even do this. Probably not as well as the advanced systems, but you can measure how the NanoVi is actually working. And you can measure that through the heart rate variability and through analysis of parasympathetic versus sympathetic nervous system. And of course, sleep is so important. And I think it is one of the overlooked things in society right now is and the quality of sleep too. Because you could get sleep, and so many people are taking their sleeping pills and different things and melatonin and all of that. But unless it's true regenerative sleep in a parasympathetic state, it's incredibly hard to heal, regenerate, all these things. So NanoVi is absolute. You're saying that's one of the top things you'll see is better quality of sleep.
Yeah. And one of the reasons you'd get better outcomes in a clinical setting, if you just put it with everybody, is that balance in the autonomic nervous system, because often people are either just generally stressed, or if they're ill, it's especially stressful. And so just bringing them back into balance a little bit will make everything else you're doing work better, including the conversations that are being held.
Yeah.
Because it just puts people in a better frame of mind. And then, of course, on the other side, that it's complementary to, if it's an IV drip or whatever, you want the protein function to optimize that as best you can and get better use out of any other treatment that you're doing.
And that's really interesting, because we always do it, like I mentioned, with an IV push or an oxidative treatment, whether that's ozone therapy, UVB, ultraviolet blood irradiation, hydrogen peroxide therapy. There's other ones, but the patient usually does ask, wait a second, am I getting too much? How does this differ? I'm getting this and this. And can you go into that a little bit on how it may differ as an oxidative therapy and how it is complementary and not sort of I would say either, overriding it or giving too much?
Oh, it's in combination with oxidative therapies. It's like a hand in glove. It's a great match, because oxidative therapies, not surprisingly, do oxidation. And so the NanoVi is a great way. The repair of oxidative damage is all done by proteins. So by supporting protein function, you repair the oxidative damage faster. Then you're just getting the good side and you're mitigating the downside of things. And so they're great combinations. In some areas, it's interesting because just improving protein function, you can get better oxygenation in the blood, for example, by only doing that without adding concentrated oxygen. And so in some respects, it helps like an oxygen therapy, but it really just augments any of them, like if it's hyperbarics or ozone or whatever they're doing. You get more oxygen in the system, and then you get the system working better. And so that utilization is really important, and you can see that in mitochondrial function. So if you can improve the mitochondrial function, you know that you're working the oxygen, you're getting better utilization, basically.
And again, it's the reason that we see, and again, we're not doing this to just say, oh, you should go on it, which we do believe that, but we're actually testing the parameters. We're seeing if a person is calling for it, in a sense, if their body requires it. And almost everyone does. I don't think there's been someone where maybe you shouldn't do this. Yes, it's incredibly complementary to all the therapies we have at our clinic, and every clinic, out there should be doing that.